So this session is really opportunities for some of the universities across the region to sort of showcase some of the work that you're doing and that we're doing, and for us in 7 minutes to sort of showcase some of our research with community. And I can't say how much of a challenge that has been, but there we go, sort of challenge Jane and Mel and others. So in terms of our approach to working with communities, and obviously we've heard a lot about this today, and for us very much thinking about innovative approaches, and I suppose for us at Bournemouth University we do think outside the box a bit, using creative approaches, different approaches, if we're really going to engage with those communities, and embedding true and meaningful research inclusion and for knowledge exchange. If we're really going to tackle some of those wicked problems that we have across our communities, we really need to bring in those different disciplines. So working very much across disciplines, across professional groups, across our university, with other universities across the region, and also other universities and other places. But also what's key, and obviously what we heard earlier on this afternoon, was that methodological expertise. And for us, we're really sort of focusing upon our digital futures, training our students of the futures, but also in our research, embedding data science. We have a data scientist, Chris Long, and other people working in the AI space as well. New and strengthened partnerships, I'll come back to that on another slide, which has been very much sort of fundamental to the research that we do. Mel here, she sort of leads our BU peer partnership, and obviously we heard a lot about engaging sort of public and patients in research. And our approach to sort of building research capacity and attracting talent into research and building talented workforce of the future, engaging them in research, and hopefully retaining that talent as well, retaining that workforce retention in research in Dorset. And then on the slide you can see just a few examples of some of our research, how we're working with communities, ethnic diverse communities, our digital health coaching project, working with older people with mild to moderate frailty, and also our NHR sort of funded refresh trial, working with care homes across Wessex and across other parts of the country, a 4-year project co-led with Plymouth University. So I'll come back to you, Becky, if you're still in the room. In terms of digital innovation and digitally enabled care, which we have had some really rich discussions about already, but for us this is a key part of what our focus is at the moment, in terms of using data to inform and practice and knowledge mobilisation, evidence interaction, and drawing upon those data sets that we have and creating that sort of living laboratory. Digital twins, personalised care interventions, and working very much with industry to sort of co-create some of those innovative approaches. And then on the top right-hand side, I just sort of draw upon a document that Professor Leanne Fenge, who's still in the room here, was involved with. This was a policy sort of connect initiative that was presented to Parliament in consideration of how digital technology in particular could help older people and disabled people to live more independently in their own homes. So we need to think about older people and other sort of vulnerable groups in the community, and thinking of how we can digitally enable their care and promote independent living. And then just to highlight some of the research centres and institutes that we have within my faculty, the Faculty of Health and Social Sciences, and it just shows the sort of breadth of areas of interest. But I think it's fair to say going forward, we are sort of rethinking and restructuring our research entities, not only within the faculty but also across university, and they will be much more integrated and very much responding to local, regional and national strategy. And then when we sat down and thought, well, who are the people that we're working with? Who are the health and care partners across the community that we are engaging with? And this is just a selection of some of those wonderful people, some of you are in the room, that we have worked with. We've co-created and co-produced research, which has contributed towards prestigious funding research as well. And it's been a pleasure working with you as well. So I just wanted to say thank you before I hand over to Mel.
I'm Mel Hughes, I'm Professor of Social Work at Bournemouth University, and I'm Academic Lead for the PEER Partnership, which is public involvement in education and research. We have around, at any one time, about 80 to 100 individual members with lived experience of health and social care, and we collaborate each year with usually around 50 voluntary and community sector organisations collaborating in education and research in the Faculty of Health and Social Sciences, but also across the university as a whole. The bit that we really wanted to highlight, and I know, Desi, you said this is our opportunity to show how our work aligns with what's been discussed today. And it just brings me real joy that sometimes I feel like I'm a lone voice when we're talking about community collaborations and partnerships, and that's just not the case. It's really changing, isn't it? And there's some absolutely fantastic work in the room. We wanted to highlight our flipping the power approach. The word power has been used today. The word kind of community has been used a lot. That shift to the community and really collaborating and harnessing lived experience expertise. But also we need to find new ways of working, has been mentioned a lot. So this is absolutely kind of where we sit. So we do a lot of work with communities using our flipping the power model. So rather than inviting people into our world, training people to fit into our world, we go to where people are, we provide mentoring, training, support, hand-holding, resources, whatever it might need to collaborate with voluntary and community sector organisations and the people they serve within their communities to have a really active voice in research. So we do a lot of community-led research, co-produced research, collaborative research, but it's about kind of ensuring that people with lived experience and our voluntary and community sector colleagues, their expertise is valued alongside the clinical and academic expertise that we already have a wealth of in the research that we're conducting. And we need to do that to address health and social inequalities, but we also need to do that to make sure that we're really kind of doing that idea of bringing the reality into our research as well as making our research a reality. So I won't read all of these out, but these slides are there because I've had the 1-minute warning. But those slides are there a little bit about some of the work. We do work a lot with community researchers, so people with lived experience of the topic being explored, but again, providing that mentoring and support. But we actually also do quite a lot of work evaluating what approaches and methods work best, because it does feel like quite new territory. Somebody mentioned this morning that, actually it was Sarah Williams, about often kind of research has been at the very kind of acute, very biomedical kind of end, and sometimes we're kind of thinking those same approaches to public and community involvement will work when we extend that to more marginalised, excluded groups, and of course they don't. So a lot of the work that we're doing is very much about creating communities where people feel they have a voice, feel that they belong. It's about really embracing the challenges, because it is really difficult, it's really messy to engage people that don't feel they have a voice, that don't trust us, are quite fearful of getting involved and often feel what's the point because it won't make any difference. So we really start where they are. It's about then co-designing with a voluntary sector organisation and the people that use their service, how will we involve people in research, and we co-design it differently to every project or area that we're working with. So I'll leave you with that, but please come and speak to us if you want to know more.